Today we are going to perform the lumbar mobilization technique, and this technique is in flexion. So we increase the lumbar spine flexion movement. Patient position on the sideline, we bend both of the legs. The knee should be at the edge of the table, so we can easily adjust the patient knee on my thighs. First clear the legs, then adjust the legs on your thighs and give him flexion mobilization. For the grade 3 mobilization, I adjust my hand on the lumbar spine, and through my body movement I give the stretch mobilization.